Hi guys. So this video is just going to go over step C on your checkoff list. And so step C is if you actually have to dilute a medication. So for your return and in your practice MARS, you're going to have one medication that needs to be diluted, and that's Ativan. That's the only medication on the return that I'm going to put on there that needs to be diluted, so you guys can have lots of good practice with it. And so Ativan needs to be diluted with the same amount. It's a 1-to-1 solution. So, okay, so I have my medication vial of Ativan, okay, and the order is for Ativan or lorazepam, 2 milligrams per ml. Okay, so when I look it up in the drug book, I know that it needs to be diluted with, it's a 1-to-1 ratio. So that means that however amount of medication you're drawing up, it needs to be diluted with the same amount of dilutant. And when I look up Ativan, it says that it needs to be diluted with sodium chloride or normal saline. So I have my dilutant. Okay, I'm going to need 2 syringes, okay, 2 3 ml syringes. I'm going to need 2 needles, okay, 2 alcohol swabs, my medication label, and a sterile cap. And then the other thing I'm going to need, and this is in your guys' practice kits and you'll have them for the return, is this DC double connector. And so I don't know if you can even see it in the package because it's clear, but it's this connector that's going to connect your 2 syringes together for you to be able to mix the medication with the diluent. Okay, so the first thing you're going to want to do is draw up your medication. Okay, again, you're taking off the cap, the dust cover, you're scrubbing this for 15 seconds. Okay, we're opening our syringe and our needle. Okay, we know our dose is an ml, so we're going to inject in the 1 ml of air, and then we're going to pull out our 1 ml of medication. Okay. When you're drawing out your medication, you really want to make sure that you have all of your big air bubbles out before you take the needle out of the vial. You want it ready to go as much as possible when you're mixing medications. So there's my medication. This one was filled a little bit less than an ml, and so I have just a little bit less, but there's that one bubble that's connected to the side, but that one's fine because again, it's not taking up any of the syringe, the the dose that's in the syringe. Okay, so I have my dose. Okay, put your sharps or click your sharps. Okay, and then just put your medication down. What I'd like to do sometimes if I have a Sharpie is just put an M on this syringe so I know for sure that this one is my medication, because obviously they're going to look exactly the same. You don't want to put a sterile cap on this yet because you need to mix the medications together, or the medication with the diluent together. Okay, so now I'm going to draw up my diluent. So I've checked, I have normal saline, 9% or 0.9%. My expiration date is 5 of 2023 because you're going to want to make sure you check the expiration date on your diluent also. So again, we are scrubbing for 15 seconds. Okay. Getting our syringe and our needle prepped while that dries. Okay. Drawing up our ml of air and then injecting it into the vial and then drawing up our diluent. You can draw up as much diluent as you want, right? Because this is not our medication. So it doesn't matter how much you draw up. You actually want to draw up a little bit more because you're going to want to prime that little connector, because that connector has air in it. And so if you don't prime it before you connect it to your medication, you're going to inject air into your medication. Okay, so I've drawn up a good 2.5 mLs. Okay, and so now put your diluent off to the side because you don't need it. Okay, put your sharp or your safety on. And now you can put your little DC connector piece on to your diluent. Okay, it's super tiny, it's clear, you can barely see it. But again, make sure you're doing that no touch method. Okay, so you put on your DC connector. You can see now I have this air. Okay, my DC connector is on. So what I want to do is just make sure that I'm priming the DC connector with saline. Okay, and so you want to push saline out, obviously, until you don't have any air bubbles. You don't want any air bubbles in your diluent. Okay, so you're going to push those right into your medication. And then as you're priming this, you want it just so there's a nice bubble at the top. If it goes over, that's fine. But you just want to really make sure that you have all the air out of your diluent. You can see again that there's a little bitty bubble. That's not going to make a difference. It's, again, those big bubbles that are taking up space in your syringe. Okay, now we are ready to mix. So you're going to take the needle off. Don't lay this down, this one down, right? Because you want to do that no touch aseptic technique. And so if you lay this down, it's going to be laying on the counter where you're going to attach it to your syringe that's going to be going into your patient. Okay, so you take your needle off and then you're going to attach your medication to your diluent. Okay, once I got all the air out of my diluent, I ended up with about 1.5, a little bit more than that, mLs of fluid. I don't need that much. And so what I do is I make sure that I am pulling the diluent down into your medication. So I know that I have exactly 1 ml of Ativan, and I need to dilute it with another ml of normal saline. And so then I'm looking at my syringe and I just pull till I have 2 mLs in my syringe total. Because then I know for sure that I still have my medication, right? And I have the correct amount of diluent. Okay, so I'm pulling and there we go. I have 2 mLs of Ativan, or 1 ml of Ativan, and then 1 ml of diluent. Okay. Once you have that done, then you can take the DC connector off. Okay. Don't twist these on super tight because they'll be difficult for you to get off. You can just discard this. Okay. You don't need this anymore. And then this is when you'll put your sterile cap on. You have everything mixed. Your medication is ready. Okay, you're going to put your sterile cap on, and then you're going to do your label for your patient and for your medication. So again, we have John Brown. He is in the practice rooms. Our drug is lorazepam or Ativan, our amount. So we're giving 2 milligrams. And it's now over 2 mLs, right? Because we have 2 milligrams of the medication, and then the base solution makes it that 2 mLs total that we're giving. Our base solution is 0.9 NS. It's added by me. Today's the 27th. It is 11:50 a.m. And our expiration date you can put for the drug, which was 2/29, and the diluent, which was 5/2023. Okay. So the biggest reason why we do labels is if you're, walking down the hallway and you have patients' meds either in your pocket or just on you, and something happens, so you have to run to a code and this falls out. If somebody picks this up off the floor, they'll know exactly what it's for. Oh yeah, and don't forget your route. So it's IV push. Okay, so they're going to know exactly what this is and who's it for. Are they going to give it? They probably won't because they didn't draw it up. But it's just in case something happens, everybody knows, again, what this is and who's it for, okay? So then you don't want to cover up your tick marks because you're going to need those when you're giving it IV push. And that is how you do an IV push medication with a diluent. All right, happy practicing. Let me know if you have any questions. Thanks, bye.